अस्सलाम वालेकुम व्यूवर्स। आज हम साइकोलॉजी 404 एबनॉर्मल साइकोलॉजी का क्विज नंबर 2 सॉल्व करेंगे, जिसमें लेक्चर 10 से लेकर लेक्चर 17 तक के एमसीक्यूज शामिल हैं। एमसीक्यू नंबर 1, ऑक्यूपेशन सच एज मॉडलिंग encourages thinness is one of the leading causes of anorexia nervosa. All of the following activities are involved in restricting type of anorexia nervosa except for binge eating. Which of the following features do not change in dissociative identity disorder phase? Sleepwalking is one of the diagnostic features of which of the following disorder? Parasomnia. Which of the following is not an environmental causal factor of dissociative disorders? Seasonal changes. All of the following are the types of anorexia nervosa except doing proper exercise. If an individual is taking excessive amount of sleep for at least 3 times per week without having the feeling of freshness upon awakening, he would be suffering from hypersomnolence. Farhana, a 21 years old, takes Myra Khan as a role model and loses her weight to become thinner like her. She may suffer from anorexia nervosa. Dissociative disorders were placed in which of the following group of disorders in DSM-4-TR? Anxiety disorders. All of the following are the types of sleep-wake disorders except for delusional sleep. Which severity level of attention deficit hyperactivity disorder does not impact the academic performance? Unspecified. How many types of motor disorders? 3 types. Persistent depressive disorder is also known as dysthymia. Which of the following disorder is characterized by systematic delusions but well organized behavior, grooming, and functioning? Delusional disorder. The professor gives difficult test. It is the type of attribution style. Specific, external, stable. Which of the following is the most decisive factor while diagnosing social anxiety disorder? Fear of evaluation. In which of the following disorder the selective emphasis on negative events play a take role? Social anxiety disorder. In the diagnosis of attention deficit hyperactivity disorder, which one of the following is the most important to specify? Is it combined, inattentive, or hyperactive? Which of the following neurotransmitters are associated with depressive disorders? Serotonin and norepinephrine. How long symptoms need to persist in order to diagnose separation anxiety in children? 4 weeks. Which of the following disorder involves a sudden, rapid, recurrent, and non-rhythmic motor movement or vocalization? Tic disorder. Which of the following structural changes in the brain can cause depression? Reduced grey matter. Which of the following contains the mixed features of mood disorders and schizophrenia? Schizoaffective disorder. How many types of episodes prevail in the bipolar and related disorders? 3 types: manic, hypomanic, and depressive. In which of the following disorder the individual cannot distinguish between the real and imagined and previously called paranoid disorder? Delusion disorder. At least one hypomanic episode and one major depressive episode criteria should be met for which of the following? Bipolar 2 disorder. Which of the following is not an environmental factor that contributes in depression? Negative thinking. In brief psychotic disorder, what is the most important to specify? The duration. Which disorder involves low mood, lack of pleasure in activities, and suicidal ideation? Major depression disorder. What is the main difference between the manic and hypomanic episode? The difference of duration. Who often has difficulty in waiting for the turn and intrude or interrupt others? Hyperactive and impulsive individual. It is essential to have both negative and positive symptoms for the diagnosis of schizophrenia. Which of the following is the main reason behind the separation anxiety? Loss of significant other, the act of taking one's life in the result of depression, other mental illnesses, intolerable mental anguish and pain is called suicide. Which of the following is not a characteristic of anxiety disorder? Loss of pleasure, inattention and disorganization and hyperactivity, impulsivity are the two main salient features of attention deficit hyperactivity disorder ADHD. It is necessary to specify prognostic features, catatonia, severity. However, it can be diagnosed without severity as well. Schizophreniform disorder, depressive symptoms evidently due to or the consequence of another medical condition and not explained by another mental disorder refers to depressive disorder due to another medical condition. A condition that features extreme shifts in mood and fluency in energy and activity levels referred to bipolar and related disorders. The differential diagnosis between the schizophrenia and brief psychotic disorder is duration. The symptoms of stupor, catalepsy, vexiflexibility, mutism, negativism, posturing, mannerism, stereotype, agitation not influenced by external is called catatonia associated with another mental disorder. A prominent and persistent disturbance in mood, elevated, irritable mood, depressive symptoms during or soon after substance intoxication, substance or medication induced bipolar disorder. There are 9 types of schizophrenia and other psychotic disorders. Which of the following neurotransmitters high and low level is associated with mania and depression? Norepinephrine. Which part of the brain is closely associated with panic disorder? Amygdala. A child who never listens to the instructions of teacher nor follows them and does not complete the classwork is suffering from inattention.